There have now been two landmark studies. So there's a US landmark study, which was led by Ruben Messer and others and has been published. And an update from that study is presented at this meeting with regard to quality of life. In the last year, and presenting for the first time at this meeting, is a landmark study looking at almost 700 patients, 699, and physicians in Europe. So the UK, Germany, France and Italy, Australia and Canada, as well as Japan, looking at patients and physicians' perception of disease, perceptions about what they want from therapies, how their symptoms are managed, etc. Interestingly, in the US there were some disparities between the physicians, what their target was. So for example, in myelofibrosis, the physician's target was improve the patient's symptoms, shrink the spleen. The patient's target was, I want to change the natural history of my disease. The same was also present outside of the US, shall we say, but perhaps the degree of disparity was a little bit less. Another interesting example for patients with polycythemia vera, where the medical perspective is reduce the risk of blood clots, the patient's perception was, I'm not so worried about blood clots, I'm worried about my symptoms, principally fatigue, and I want to slow progression of disease. So it's really interesting, perhaps not surprising, but really interesting. The other interesting data that came from the ex-US landmark study was the impact of having an MPN upon the patient's socioeconomic function, if you like. So the impact of disease on their family, but also importantly the impact of disease on the patient's ability to work. So what we saw in this study and demonstrated for the first time was around 20% of patients reducing their hours as a consequence of disease, 10% of patients taking on a less intensive job, 10% of patients taking voluntary redundancy, for example. So we start to unravel for the first time the real impact on an individual and their family of having this disorder beyond what we conventionally think about medically, which is risk of blood clots, risk of progression, and how well are we managing your disease.